Hi, this is Zach and Sabrina with Alpine Rescue Team. Today we're going to be talking about shock management. First, I'm going to talk just a little about what shock is. Shock is a perfusion issue to the body, a lack of perfusion. Perfusion is the delivery of oxygen to target tissues and organs and the removal of waste products and CO2 from those target tissues and organs out of the body. A lot of things can cause shock. A lot of times trauma, bleeding out, things like that cause it. There are some very specific symptoms you're going to be looking for, signs and symptoms. Typically your patient is going to be tachycardic, so they're going to have a very fast heart rate. They're going to be tachypnic, so they're going to be breathing very quickly. These are compensating mechanisms trying to increase the efficiency of the perfusion they do have going on in their body. They're also generally going to be hypotensive. They're going to have a low blood pressure. When you look at this, your patient, they're going to be pale, cool, and diaphoretic or sweaty. And these are very important things to recognize. This is an immediate life threat that you need to deal with very quickly. Your patients can go downhill very quick. So if you first, for OEC, you initiate standard precautions. As you can see with my gloves, you're going to ask for permission to treat. You're going to go through your primary assessment. You're going to recognize shock, and then you're going to address shock. The ways you're going to address shock, three main things. You're going to put your patient on a non-rebreather at 15 liters per minute. And then you are going to put them in what's called a modified Trendelenburg position, which is basically just elevating their legs above the rest of their body. The idea behind this is to help increase blood flow to the rest of the body, to all the vital systems, to help keep her alive for as long as possible until you can get her to definitive care. And the last thing is to prevent heat loss as much as you can, because it's very easy for patients to get hypothermic when they are in shock. Do also keep in mind, we're talking about, this is often a wilderness setting for the rescue team. The ground is very cold, snow is very cold. Just putting stuff on top of her isn't going to help if you have a cold ground. So make sure to remove her from the ground and get jackets, padding, sleeping bag, anything like that underneath her as well to remove her on all sides from the cold environment. After that, you're going to provide for a rapid transport. You're going to reassess vitals every 3 to 5 minutes because this is a critical patient.